Hello, good evening, and welcome to yet another episode of Health is Wealth. So, this night we'll be discussing about antenatal care. You know, some women, when they are pregnant, they fail to go for antenatal, saying that it is not necessary, but forgetting that it is wise and necessary for you to go for antenatal care because there are some certain things that you don't know about that you will be informed about, educated about there. So nurse as usual will be telling us the benefits of antenatal, what stages they care, uh, what do you do when you go for antenatal, what is there any complications that can be noticed if you go for antenatal. So nurse will be educating us.
Okay, thank you. Antenatal is the care given to women during pregnancy. Antenatal period is from the day a woman misses her menses and on maybe going for pregnancy test, it is confirmed positive. From that time to time of delivery is the antenatal period. And this time has 4 stages. Antenatal has 4 stages. Though it's 3 that is very noticeable. The 3 stages are the first 3 months, first trimester, the second 3 months, 4, 5, 6 months, the second trimester, and the third stage, which is the last trimester, the third trimester, 7, 8, 9 months. These periods have different things that is being checked out for. So when I talked about the fourth stage, that is the period or the 9th month till the patient falls into labor and delivery. Now, some women do ask, when are they expected to go and register? It is advisable that in the first 3 months, you must register for antenatal. Why it is advisable to register in the first month is to get the data of the client and that first month when the baby is just forming for the first time. For example, it is in that first visit in the first month that sugar test is monitored on the woman. Her weight is monitored. Her blood pressure is measured. And some other tests. But what we're talking about is 1, HIV test. If detected early in that stage, you know the type of drugs to place such a woman on so that we have that prevention of mother to child transmission of HIV and AIDS. It is when she comes early, you are able to rule out overweight. Because if the patient, for example, is 45 kg on the first 3 months, in the second 3 months, she comes in and weighs 65 kg, you can see that from 45 to 65 that the increase is just enormous. Then you start to think of something. You start to think of some abnormalities, excess fluid in the stomach, or multiple pregnancy. It is in the first month you know the sugar level of the woman, so that as she comes in the second trimester and third trimester, when the sugar level is being repeated, you know if this patient is the type of person that develops sugar during pregnancy, or that she was diabetic before she took it. And this will help know how to treat the client. That is why of late it is called FAC. Why it is called FAC is for each and every individual. You now treat for each and every individual. You don't treat antenatal cases the way you treat this person is the way you treat the other person. No, it is for each person.
Different bodies,
different complaints, different results, different treatments to be meted out. So this is about antenatal. It is very, very, very essential. That's why they do syphilis test, VDRL, to rule out if the patient should be operated upon to save the baby's face, or if the woman is okay.
That is when you check if she has if she can be able to give birth by herself.
That is done in the last stage, which that is when I call the fourth stage. The fourth stage is that 9th month. Is when the woman is about 1 month to the time she will deliver. You do the pelvic assessment. Pelvic assessment is done only on first pregnancies.
Okay.
So that you ascertain if the cervix is roomy enough for the passage of the baby. So other people that might not be first pregnancy that you do pelvic assessment on are those who went for CS in the first pregnancy, maybe second pregnancy, and without knowing the actual the actual stage of the service. So maybe the woman will want to say, I've stayed long before taking in now, so I want to deliver my baby. Because we are not sure of what the service is due to she has been doing CS, you do pelvic assessment.
Okay, at what month is it advisable for a woman to go for scan to check the position of the baby, if the placenta is okay?
Okay, it is advisable to go for a scan after 5 months. Any scan is good to go for scanning after 5 months, when the baby must have at least grown to an extent, unless where there are some uncertainties about the pregnancy in the first 3 months. Then the person can be sent to find out if there's a pregnancy there or not, to clarify the pregnancy in the first 3 months. If there's no need for clarity before, or it's better to go on the 6, 7, 8 month.
Okay, is there any complications that can be noticed during the antenatal care?
Complications, yes. It is during antenatal care, especially when you come to the 3rd stage. It's then you will know if the baby's position. It is that time you will know how or what to expect during the delivery. Because once the position is not longitudinal, then you start to think of delivering the child through CS, cesarean section. Then if the baby is extra large, you know that the woman cannot have a vaginal delivery due to it is first pregnancy.
So who causes spotting? You say some women they are pregnant but they have spotting, they have drops of blood.
What? Some might be some some abnormalities in the woman. Naturally, a woman that is pregnant is not supposed to be sporting during the pregnancy. Okay, some people might have some underlying cause, which, if they like, which is advisable, after delivery, they are supposed to go and do some hormonal tests to rule out certain things.
So, our lovely audience, you've heard it. It is necessary, it is important. It has been emphasized that once a woman is pregnant, she's supposed to go for antenatal care from her first trimester till she delivers, even postnatal care. I hope you learned a lot from this short video, and don't forget to subscribe to our YouTube channel, Health is Wealth. Thank you.